Hello, and welcome back to Spinning the Medical Tea. I'm Lexi, ED nurse by day, sewer, and history nerd by night. So, what are we going to be talking about today? Sajid Javid, sorry, I'm butchering his name, so apologies if I am, has said patients should pay to visit their GPs and for A&E visits. Seriously, the former health secretary can kiss my ass.
I sentence you to kiss my ass.
I cannot believe he suggests this. This is absolutely appalling. So, this is what the news article says. Patients should be charged for GP appointments and A&E visits. Sajid Javid, again, sorry if I'm butchering his name. I'm dyslexic, by the way, so that's my excuse, has said, as he calls the present model of the NHS is unsustainable. The former health secretary said extending the contributory principle should be part of the radical reforms to tackle growing waiting times. In an opinion piece for The Times, he called for a grown-up, hard-headed conversation about revamping the health service, noting that too often the appreciation for the NHS has become a religious fervor, don't know what that means, and a barrier to reform. The Prime Minister, Rishi Sunak, is not currently considering the proposal, Downing Street told the newspaper. During his campaign for the Tory leadership, Sunak sets out plans to issue £10 fines to patients who miss GP appointments or hospital appointments. But he backtracked on the pledge after it was widely criticised by health leaders, signalling the controversy surrounding any reforms that are threatening principle of free NHS care at the point of need. Okay, I'm sorry, but we do pay for the NHS. NHS isn't free, that's what national insurance is for. So let me get up my most recent payslip. Give me a minute, let's see. How much do I pay a month for national insurance? Here we go. My November payslip. So apparently I didn't download my December payslip. But November payslip. For national insurance, I paid in November £107. So I pay, let's just dial it down, £100 a month. I pay towards the NHS. I don't go to A&E. The last time I went to A&E was when I thought I broke my finger in, 2016? I was at the gym. I threw up a medicine ball and it landed directly on my finger and I heard a crunch. I couldn't move it. It was swollen, couldn't bend it, couldn't move it. And I waited 6 hours because, us nurses, we're tough. Didn't want to go to A&E. Well, I worked there and I didn't want to waste time. Waited 6 hours. It's swollen to about 3 times the size of what it should be. It was very black. Couldn't move it, couldn't bend it. Went there and I'd broken my finger. Well, they thought I'd broken it. They weren't entirely sure. The x-ray was inconclusive. So, buddy strapped it, healed in about 4 weeks. Happy days. That's the last time I went to A&E. Now, recently, because my health hasn't been very good, I have been going to my GP very regularly. But yeah, £100 a month I pay for my national insurance for the NHS. So we do pay for it. It's not free. So to say that we have to pay to see our GPs and we have to pay to go to A&E is absolutely ridiculous. What about pensioners who can't afford to pay? What about people on benefits who can't afford to pay? What about the pensioners who have paid all their lives national insurance and now retired? What about them? They've paid all their lives to the NHS. Why should they have to pay for A&E? And it's an accident and emergency. They didn't intend to fall on the concrete and break their hip. They didn't plan to have a heart attack or get run over by a car. Why should they have to pay for A&E? Now, don't get me wrong. We have a lot of people who do, a lot of time wasters, and a lot of people who abuse the system. I know we see a lot of people who come into A&E who don't need to be there. But a lot of the time it's because they can't see a GP, they can't see a doctor, or lack of education. But rather than fining them, how about we educate people? Or how about we get GPs to see patients again? Because GPs still aren't seeing patients. Now, I can't say I've had that experience. My GP's actually been very amazing. I can ring them and say I want a GP call back today. and I will get a GP call back today. And if the GP feels I need to come in to see them, they will say, can you come in at this time today? And they will see me today. Or if it's non-emergency, it will be a 2-week appointment, which is fine. You know, and I know not everyone can say that, but my GP's been amazing. But before COVID and after COVID, we are suffering, but GPs need to see patients because GPs still aren't seeing patients. And that will help lift up the load off A&E departments, and that will reduce waiting times. But again, you still get people who call ambulances who don't need ambulances. Like, for example, one of my friends who's a paramedic, they were called to someone's house because their cat was injured. Who calls an ambulance for a cat? But this is not the way to tackle the NHS. More funding, getting people out of hospital. 80% of people in hospital do not need to be there. They're waiting for a social care package because they're not safe to go home. What you need to do is increase money into social care so people can get social care packages to go home, increase nursing care placements, or reopen the community hospitals all the Tories closed down. If you reopen community hospitals, they can give people physio, get them so they can mobilise safely at home, get them so they can have OTs, physios, get equipment back into their home so they are safe to go home. So these community hospitals is what helped with the flow inside hospitals, because if a patient is medically fit, doesn't have any medical needs, they're just waiting for a social care placement, they get moved to the community hospital where they're not sat in bed all day. You get OT and physios who get them up and moving every day, make sure their mobility doesn't decline, so they're not sat on the bed, get chest infections and UTIs because they're not moving at all, whilst they're waiting for the social care package. That's what these community hospitals were for. And because the Tories closed them all down, these people have nowhere to go. So they just stay in hospital where we're understaffed, don't have OT and physios because they're overworked and understaffed. So they lie in bed all day, so they get a chest infection. Oh, okay, so they've got to stay for another 2 weeks. Then they get a urine infection. And because they've got a urine infection, they get confused. They then fall over. Oh, look, they've got a head injury. Or look, they've got a broken hip, so they've got to be in here for longer and longer and even longer. So that's what the Tories need to do. Not charge people for seeing GPs or go to A&E. They need to open community hospitals, get these medically fit elderly patients out into the community hospitals so they can get social care input so they can go home or go to a nursing home or residential home or get the OT and physio they need so they can go home safely. That's what the government need to do, not all this tripe. This is absolutely ridiculous. Now, thankfully, our Prime Minister isn't considering these plans yet, but who knows with the Tory government. Sorry, this has been more of a rant than information, but this is what the Tories are planning, and the NHS is not looking good at the moment. Waiting times are really long, ambulances are queuing outside, the NHS is at breaking point. Nurses are striking, ambulance staff are striking. It's not going good. The Tories are running us to the ground. And I honestly don't know what's going to happen next. We'll just have to wait and see. We can just hope nothing bad happens. Anyway, that's it. Sorry for the sombre note, but I just had to talk about it. I hope to see you in my next video. And I'm about to eat my Cadbury's cream egg because they've finally come out in the shops, because they only come out in Easter apparently, which is just mean. Right, I'll see you later.